healthcare professionals are like an orchestra consisting of different instruments, and within that, social workers play an important role in helping Asian patients.
Being a social worker, I feel it means somebody who will be able to empathize with you, sympathize, whatever it may be.
Not speaking English can be a very challenging situation. It hit very close to how I grew up.
So I was working in the fashion industry for about 8 years. And during that time, I volunteered in many different settings. And I realized that the more I volunteer, the more I find joy in my life.
A lot of misconceptions come from misunderstandings. Social workers help bridge the gap in terms of accommodating Asian patients in the complex hospital environment.
People don't understand what social workers do in a medical setting.
他们在社会上面、经济上面都是比较弱势。
When they are admitted to hospital, they are very nervous. They are sometimes even the self-defense.
A lot of times within the Asian community, they want to keep things within the family.
The Chinese patients, they really value family.
So a lot of times just really making sure that we're attuned to what the family dynamics are.
What's the dynamics like with their family? What's their living arrangements?
It's a collaborative effort. It's not just the patient alone.
The social worker team in the hospital works very, very hard. It's a very challenging job. Every month I have what we call Coffee with the President, and social workers are included in that.
So the staff is very open and communicate with us on a regular basis.
So if the social workers have challenges, we expect them to be able to escalate those challenges up to the senior management team.
In order to provide culturally sensitive services for patients, the different sectors of the healthcare industry have been putting a lot of effort into enhancing patient experiences.
When they come to the hospital, it could be an intimidating experience.
We have established a patient navigator program with them from the moment that they come to the emergency room all the way to when they're discharged.
We are expanding VRI. It's called Video Remote Interpretation. Instead of just speaking on the phone, they will see a person on the iPad translate the conversation for them.
We also have a lot of signs that are written in Chinese language.
We provide translator 24/7 in Chinese.
We are currently doing a lot of work with CAIPA, which is the ambassadors in the emergency department. Those ambassadors not only providing translation and facilitating the patient experience, but they coordinate the relationship with the referring physician, with the clinicians.
And then the other thing we're doing is we will have like a hotel room service model.
It's very tailored to the patient's taste and culture, what they like.
However, hospitalization is a temporary phase. Eventually, the patient will be transitioned back to the community.
We discuss every single patient, the challenge for discharge, including the follow-up appointment, and also some social issue that we can help.
If there is no social worker in my team, then we will have a problem referring patients back to Asian communities.
We are active in supporting the community through a lot of events.
We have a system of neighborhood care centers. We offer Tai Chi, we offer meditation, we offer a number of activities.
Whatever the community is comfortable with is our goal.
Being on the front line with patients, social workers have memorable stories of joy, as well as those of tears.
One story that impacted me the most, it's of a patient who was diagnosed with end-stage breast cancer in her early 40s. This patient had a husband who worked out of state. So when I met her, she was in tears because she had a chest tube in her lungs. She initially had visits from a nurse, but insurance company just stopped authorizing those visits. I contacted the insurance company, I escalated her case, then have them continue to authorize the nurse visits to go in and help her manage the chest tube. A lot of times when she was crying, it was because she didn't have the emotional support, and her husband put out like rules. He thought that whatever she had could be contagious, so he would not allow her to eat on the dinner table. So to her it was really hard because she's a mother and that she wanted to be with their children. Her time was very limited. All I could provide is the listening. When I met her, she was at very end stage and still fighting, going to the chemotherapy. She didn't miss one single one, and still trying to be there and be the parent for her children. That's very admirable. Yeah.
hospitals and insurance companies are all striving to provide better services and lead future healthcare development within the wellness system.
We learn a lot from our patients about what their needs are.
Chinese patients are more comfortable when they see another Chinese face.
We will continue to do our best to hire staff that match the community that we serve.
The medical system is evolving. And part of the insurance company's job is to make sure we listen not just to the physicians, but we listen to our members.
We need to move the healthcare system to one that is not just a sickness system, but it's a wellness system.
I think another aspect of the future of the healthcare system is addressing disparities in people's social and economic circumstances that might impede their best health. That may prevent them from achieving the optimal level of wellness.
The future of the medical system is at an inflection point. How do we empower physicians to make more decisions for the patients? Secondly, is how do we empower patients to make healthcare decisions for them?
We can potentially facilitate care using telemedicine and digital health platforms, where we can provide care in the patient's home. That's an important priority for us.
Social workers don't expect anything in return from patients. Instead, they often find fulfillment in the work, which keeps them moving forward.
No two people's experiences are the same, so it's really important to just be able to listen.
I believe that every single patient matters. If they really need a voice, I would like to become that voice.
对于中国病人来说，他们需要的东西其实不多，可能过去慰问一下，他们其实都已经很感激了。病人在出院之后啊，会专门写感谢卡寄回来给我们。
病人教会了我很多的东西，很幸运吧，就是自己可以参与这样子的一个历程。
To be able to see somebody go through so much.
It tugs on the heartstrings sometimes.
What I just want to do is just make a little difference. Is that one person that I touch that could touch others and create a ripple effect. And that's all I want.
I'm incredibly pleased that CAIPA chose with this gala to honor the social workers.
Without social workers, we can't give the patients the social and beneficial aspects they need to be able to move on with their illness and to make the appropriate adaptations.
感受得到他们是热爱这份工作的，
付出很大的努力，每天都很艰辛。
We love our social workers, and we couldn't run the place without them.
Without them, we're like a car missing a wheel.
I want to thank the social workers so much.
Thank you, thank you, thank you. You do an amazing job every single day.
You are such an incredible member of our team. Thank you.
Thank you.
Thank you very much. 谢谢你。